Thank you, Mr President. I seek leave to make a brief explanation before addressing a question on the topic of health system capacity to the Minister for Health and Wellbeing.
Granted. Leave is granted. The Ms Franks.
Thank you, Mr President. We know that our health system is under pressure and chronic under-resourcing of our public hospitals is leading to nurses burning out as they feel pressured to take on double and extra shifts to meet the needs that we currently have. Widespread fatigue across healthcare staff is creating unsafe hospital environments for both the workers and, of course, the people in their care. My questions to the Minister are: what steps are being taken to address overwork, fatigue and burnout in our nursing and midwifery workforce? And what strategies does the government have for growing and supporting the workforce, particularly when it comes to retention, but also, as we know, as we look to the future of seeing shortages as people retire?
Minister for Health and Wellbeing is the call.
I thank the honourable member for her question, and it's a very pertinent one. We are clearly seeing a situation where our nurse workforce, and for that matter all elements of our health workforce, have now been working in a pandemic environment for 18 months. So it's really important that our management and our nurse leadership continues to provide care and support, but also to refresh the workforce. And so just recently there were 3 of our networks that went out to advertise for additional nurses. I think the number was about 340, it might have been 370, but that is part of trying to ensure that we continue to expand the workforce, considering the growing challenges, but also to refresh the workforce. We are certainly looking forward to the completion of the academic year for a whole cadre of nurses, and we're certainly interested to see what capacity there could be to recruit from that cohort as part of the pandemic response. The pandemic response is obviously very dynamic. In the initial phase, the nurses were the backbone of our MediHotel and our testing initiatives. As we are now in the vaccination phase, the nurses are also again showing their agility and versatility in being strong leaders in the vaccination effort. The challenge of making sure that the workforce continues to be available for the various health challenges is also impacted by, if you like, the cyclical nature. Whereas testing and MediHotels have been relatively stable over the period, vaccinations obviously are a peak event. You know, we would be expecting significant numbers of nurses to be able to be redeployed as the vaccination program comes to a conclusion. So that will give us an opportunity to refresh going forward. And talking to nurse leaders, for example, at the Wayville Clinic, they talked about strategies they have to try to support their nurses in the vaccine environment. For example, they would deploy nurses from the mass vaccination clinic, but then also give them the opportunity to have a different work experience by perhaps being part of a pop-up clinic like the clinic at the Myer Level 3, or a mobile clinic such as the Hutt Street clinics. So I've got no doubt that nurses right across the state are continuing to work very hard. We are very grateful for their versatility. Many of them are taking on challenges that were, if you like, they weren't trained for. This is the pandemic is throwing up both challenges and opportunities for nurses and other workforces. But certainly, workforce recruitment has been a major part of this government's effort to support the workforce, and we'll continue to recruit both in the pandemic response and also in the business as usual response.